Good morning. I'm Rida Athanasius from San Francisco, California. I want to thank you all for making the time and thank you all on behalf of our team all across the USA. Syed?
Good morning. My name is Syed Hassan. I'm really happy to be part of Magdi Yacoub Global Heart, and I'm from Texas, live in Dallas. Thank you. Hassan?
Hi, everyone. My name is Passan El-Shiwi, joining you from San Jose, California. I'm a believer in the cause, and I hope you are too. So please make sure you show your support by liking our Facebook page, the Magdi Yacoub Global Heart Foundation, and our YouTube page, the Magdi Yacoub Global Heart Foundation. I'll pass it on to Wael.
Hello, everybody. Welcome to this event. It's good afternoon from New York. And we will start by a very small video, a 2-minute video, and then you will meet Professor Yacoub, who will tell you about Aswan with the rest of the Aswan Heart team, and will answer all your questions. And on behalf of all the patients and on behalf of all the Aswan Heart team, we would like to thank you for your time and for your continuous generous donations. Thank you so much and enjoy.
In a short note, Aswan is a unique facility inspired by one of the most leading cardiac surgeons the world have ever known, and that's Professor Sir Magdi Yacoub, who started the whole thing with a very small group of people 11 years ago.
The Aswan Heart Centre is a unique place for many reasons. One is that it is very badly needed, but importantly is that a group of people who believe in the cause have got together and formed a team which they are totally dedicated to achieve what they believe in, which is social justice, excellence at a very high level, and respecting human beings. Humanity comes into it. So those two elements of humanity and science and innovation came together, and it's wonderful to see that a group of people of all ages, mainly young, to sustain the future, have come together, believe in what they're doing, and doing it to the very best of their ability, and believing that there is always room for improvement, what we call Mount Excellence.
What Aristotle have said more than 2,000 years ago, when he was asked, what is excellence? He said, excellence is what we do every day. Or as Magdi Yacoub put it, how to continue climbing the Mount of Excellence. Of course, to reach excellence, you have to have the young talent who can get from A to Z, and you have to complement that by research and impeccable clinical audit. The key is really the quality of the service we provide. Prof Yacoub have set up the bar very high, the bar for quality, and nothing but the best standard should go.
Mount Excellence is something which is unachievable, but my God, we'll try. Keep trying, keep trying. I think quality is an easy thing to say, but with time you realize that quality is a term which requires very deep thinking, soul-searching, if you like, evaluating every procedure, not at the time of either intervention or operation, but long before and long after, decision-making. All these things need to be reviewed continuously, because it is not something, like I said earlier, it's climbing Mount Excellence. It's an endless process, and it is essential to continue the process of maintaining quality. And that's what's needed most in Egypt, but also around the world. It is not a matter of a sausage machine with doing as many as you can at any quality. It has to be that top quality which is always and continuously being evaluated and bettered. And so this element of humanity, social justice, and treating conditions which are very complex, and making sure that the most needy, the poor people, get the very best treatment as we go along. Nobody pays a penny. It is zero. And this is essential because a very large percentage actually live below poverty line. And it is absolutely essential to treat people in an equal fashion, regardless of their color, creed, religion, money. So you cannot buy services. Actually, it's a human right to have the best treatment available, and it is being assessed at the level of the community at large. And that's what makes Aswan Heart Centre unique and wonderful, and it's a model which needs to be continued. What has happened over the years have superseded our expectations, and obviously we're absolutely delighted. I was full of enthusiasm, believed in the cause, felt that we can do it together, with the emphasis on we, and that there are very good quality young people to see that. While there has been massive successes, but it is important to realize that there is massive more needs to be done. Now, the admission criteria are that the most needy patient, either financially, socially, and or importantly, type of disease which cannot wait much longer. So that is number one. Number two, complexity. The more complex the lesion, the more priority it takes, because there's a lot of expertise which has been acquired and continues to be acquired at the Aswan Heart Centre to deal with these complex diseases which will not be treated anywhere else. So that gives them a priority. The next priority is people living in Aswan. They have nowhere else to go. So, and the center belongs to them, if you like. So that is a priority. Emergency treatment, as I mentioned earlier, like primary PCR is very important. Babies who cannot wait, otherwise they'll become inoperable or die. 80% die within the first year. We have to stop that.
أنا هبة رشاد، مامة كارما هشام. اكتشفت مشكلة كارما في القلب وعرضت ورقها على مؤسسة مجدي يعقوب. أول ما اتولدت قعدت في العملية حوالي 7 ساعات، وقعدت في رعاية مركزة يومين. كارما كانت مبسوطة جدا مع الدكاترة والتمريض هناك، يعني أول مرة بنتي تحتك بتمريض ودكاترة تحبهم، وكانت متصورة معاهم وحباهم، كانت بتسأل عليهم حتى لما روحت البيت فاكراهم بالاسم.
Heart team is a word which has evolved over the years. It means more than one thing. One, it is a team effort, because nobody can do anything on his own. That's a disaster. But also, looking after a patient with heart disease, it transpires that you need a lot of expertise, the so-called multidisciplinary teams. And that is beautiful in the Aswan Heart Centre. You have the nurses, you have the technicians, you have the doctors, you have the researchers, you have the bioengineers, you have the molecular biologists, you have the bioengineers can create modeling. So the whole thing is a totality, and that is what's meant by the heart.
The heart team is a relatively new concept. It's less than, let's say, 15 or 20 years old. And the real benefit of the heart team is to get the collective experience from each one of those, each in what the person specializes in, and not to get individual ideas of what should or shouldn't be done. So what happens is the heart team meets and sees the patient, examines the patient, looks at all the investigations that are done, and from each one from their own point of view would make suggestions.
A heart team is essentially the ability to harness all the different expertise within a medical team and utilize them to the best interest of the patient. The reason why this has become extremely important in heart disease rather than other specialties is heart disease has evolved dramatically. There are a number of subspecialties within heart disease. So you have someone who treats children with heart disease, who treats congenital heart disease, someone who fixes heart rhythm disorders or electrical disorders within the heart, someone who specializes in coronary disease or in valvular diseases, in hypertension. Similarly, with surgical interventions, you have surgeons who are completely subspecialized in aortic valve surgery, for instance, or in mitral repair, or in complex congenital heart disease. So the more specialized people become, the more you want to get people from different specialties to look after patients, especially those with very complex types of disease. So the COVID era has been very challenging for everyone around the world, obviously, but it also has been challenging at the foundation at Aswan Heart Centre. It's been very difficult for patients, the families, for staff, and for the leadership and management of the foundation, essentially when it comes to how can we continue to run service during such a difficult time. We weren't hit by a pandemic before. It was very difficult to understand how you can continue to operate in a safe way. Now, we obviously did not want to keep patients from receiving treatment at the proper time. So emergencies were running as normal, but with elective cases, we initially took a big hit. And it was very difficult to maintain virtually any sort of elective activity. But over the ensuing few months, we put in a system where we are able to maintain safe operations. So that required a lot of layers of safety within the center, within the entire application and acceptance process. And through that, we're now bouncing back to, I would say, normal 2019 levels of activity.
The COVID affected our work in the surgical department in a very big way, especially at the very beginning, in the mid-2020 when it was all starting, and no one really knew how we can deal with it. But I think it was a good opportunity for us to get together and up our game. So there was a mixture of repeated testing for the staff and the patients, as well as zoning of the hospital. So we had special zones for the suspects and zones for the positive patients. This was in order to try as much as possible to continue with the surgical activity and help as many patients as we can. Of course, at the very beginning, there was a time when we were only doing urgent or emergency cases. But then as we gained experience on how to deal with the COVID patients and how and when to do the testing and how to do the proper zoning of the patients and the protection of the staff and the patients and the families of the patients and the staff, then the ball started rolling again. And we've been practicing normal activity for quite some time now. For the last 4 years now, we've been doing a slightly over 1,000 open heart cases every year. So this has been the average. Of course, last year there was a small dip due to the COVID situation. Actually, it wasn't a very big one. We did a bit better than we had expected. The types of cases that we perform, we do open heart surgeries for both adults and pediatrics of a ratio of around 60% pediatrics and 40% adults. And there's a huge waiting list in the country. So what we do is we prioritize our patients according to clinical need, whether it is clinical urgency or the very difficult complex cases that cannot be done elsewhere in the country. catheter interventions have developed in a big way over the past period. It has taken away some of what cardiac surgeons have been doing in the past, but it has also helped us as cardiac surgeons to focus more on a lot of very interesting areas. Ones like valve repair, whether mitral, aortic valve or aortic root, or to focus on the complex congenital heart disease, ones that cannot be treated by catheter intervention.
So catheter-based interventions essentially mean fixing a defect within either a vessel or the heart without resorting to an incision, a surgical incision. So what we usually do is we fix blood vessels, we fix holes or defects with the heart, and lately we fix valves that are not functioning normally through a tiny hole either in the wrist or the groin. And well, this is not exactly something new, but the range of diseases or problems that we can treat effectively via a catheter-based approach has evolved dramatically over the past period. So we're now able to treat very complex types of diseases which were only amenable to treatment by open heart surgery. So Aswan Heart Centre runs a busy interventional cardiology service. We perform around 4,000 catheter procedures a year. The vast majority of those are interventional. That means that they're not just for diagnostic purposes. Some sort of treatment is offered. And they vary between coronary disease for patients either presenting with emergencies, with heart attacks, whom we take within a few minutes into the catheter lab to open a blocked vessel, or those with chronic type of disease with blocked vessels as well. But we also treat children with congenital heart disease. Those are born with a defect or more in their heart. We treat adults with valvular disease, a problem in one or more of their valves. We treat patients with heart rhythm disorders or electrical disturbances. So I would say anything that has to do with the heart and has a catheter-based procedure is attended to at Aswan Heart Centre.
أخذت أسبوع بسم الله ما شاء الله، يعني عناية يعني من آخر كلام. رحت مرة متابعة بيوسف فقالوا لي بسم الله ما شاء الله الحالة كويسة واستقرت، واللعب والأكل أحسن من الأول. ما كانش بيطلب حاجة، دلوقتي أي حاجة عاوزها بيطلبها.
So the Magdi Yacoub Global Heart Centre in Cairo is a project that we're all looking up to in a big way. So the reason being, we've been here in Aswan for the past 12 years, and we've enjoyed seeing the center grow in terms of sheer size, in terms of number of doctors, in terms of the number of patients we serve every year, but we've sort of reached a cap for the past 3 or 4 years where we're unable to increase our productivity. And it is probably one of the most disappointing experiences that we have to go through almost on a daily basis when we turn down a patient for treatment because we simply don't have a place for him or her.
So as we went through the journey, and in the last 5 to 6 years, at Aswan Heart Centre, it becomes apparently clear that we cannot meet the demand. So the supply was very much short in relation to the demand. And our doctors were left with a very difficult decision to make of giving the priority to who we accept and who we cannot accept. In spite, we have used every single inch of space to be able to provide service to the patient, and Aswan developed eventually to be just over 100 beds. We increased the number of our intensive care beds, either adult or pediatric. We increased the ward number to absorb. But in spite of all of that, it became clear to all of us, either board members, management, or clinicians, that there is a great need to open a new center. And from there, really, the idea or the concept of opening a new hospital or a new center have developed to be complementary to the success we have achieved in Aswan.
This is simple because as we went along, we found that the demand was huge and that we need to do more without sacrificing quality and without sacrificing what happens in this particular hospital. Aswan Heart Centre has to continue to grow.
However, the board decided, okay, if we're going to embark on such a huge investment, which it is, we really needed to have a comprehensive feasibility study. So, Gratis, McKinsey and partner have really done a comprehensive study. And there's a lot of people from our side and from McKinsey side have contributed to this feasibility study, which took about 5 months. And at the end, it came up with a definite conclusion about the need for a new center. And it confirmed what our clinician and what the board knew. And from there, really, it was the job of the trustee to make sure that this happened. Eventually, we have decided collectively that the new center should be based in Cairo. So in this way, we can serve the southern part of Egypt from Aswan and from something like Asyut upward to Alexandria can be served very, very easily in Cairo. And eventually we came to 36, we purchased 36 acres from the government in 6th of October, next door to Zubail City University. And on that, we decided we will build a new center. Following from that, we needed to commission the best of architect, the best of designer, the best of medical designer and the research designer and the environmental designer. I mean, it's a whole huge team. And we chosen wisely as a board and management to have Foster and Partner as the architect for the project, and Dar al Handasa to be our electromechanical and our local people on the ground in Cairo.
The actual engineering and the design of the hospital, having been designed by Lord Norman Foster, is incredibly futuristic and includes certain ideas which has not been tested before, which are fantastic. And that is to make sure that the conditions for work are ideal, but importantly, that the conditions for recovery are even more conducive to rapid recovery. I have never seen anything as beautiful, not only aesthetically, but functionally, both to the workers and to the patients. For example, every single patient room in the hospital will be able to see something inspirational. When it was going to be Aswan, it was going to be the Nile. Now, every room and every patient from his or her bed will be able to see one of the wonders of the world, the pyramids. So the design of the hospital, it has a lot of greenery around it. It encompasses the research center, which is actually intercalated with the clinical facility, like I was saying earlier, the so-called heart team. The heart team has to have all aspects of other multidisciplines, but also research and innovation. That will be in the design of the new hospital.
As a result, really, the result of all of that, we have designed a very unique center, which take in consideration, I mean, the uniqueness not just in the aesthetic look of the building, but the building really, in every concept, in every inch of it, it have designed to create the best environment for the people who are working in it, because we believe that if you create a great environment within the building for people who are working there, you improve your productivity enormously. And also, it is a very conducive environment for speed of healing, because all the publication that the environment of the building can be a very important element in the healing process, post-operatively or post-interventionally. I've said all of that. I mean, you will be soon, when we commission this building to receive its first patient, God willing, Bismillah, will be on September 2023. So we're not that far. We already have started the foundation, and we already have started the second stage, and the contract was, after a fair competitive tendering, was given to Rascom Construction Egypt. The new center, if you take the new center, which is 300 bed and 5 operating theater and 5 cath lab, and have a huge research center and a center for innovation and a center for teaching, and it also have an accident and emergency centers with ability to isolate and to decontaminate, which is really the latest in building design, in hospital design. But seeing is believing, and inshallah, in under 3 years, you'll be able to see that for yourself.
The new center in Cairo will offer us, I think, at least 3 to 4 times the existing capacity. We'll be able to serve more patients. We'll be able to minimize the waiting lists and the waiting times. Even for patients who get admitted, they don't have to wait for 3 or 4 months to get their definitive treatment. We'll be able to come closer to patients. So it comes as no surprise that we treat patients from everywhere in Egypt. And some of those have to travel a long distance because what we offer here is not available elsewhere in the country, and they simply have to go to Aswan. So I think being in Cairo is A, will increase our capacity, B, reduce our waiting times, and C, get closer to a number of patients who would otherwise have to go through a difficult journey, to say the least. Now, this only makes sense because heart disease is the #1 killer around the world. So 40% of deaths around the world are due to heart disease. In Egypt, this is not significantly different than elsewhere in the world. So there's a huge demand, and we hope we can only serve but a fraction of this demand by moving to Cairo.
So between the new center and Aswan, we will be able to see about 120,000 patients, both adult and children, and the majority is usually children, about 60% of what we do. The outpatient will be able to perform combinedly about 12,000 procedures per year. I think this number will go a long way to meet the demand which we spoke about before. However, in the new center, it's not about only treating patients. It is really about quality treatment, a good training and apprenticeship to create the second and the third and the fourth generation of cardiac surgeon and cardiac interventions and cardiologists. And the third part is to enhance research and innovation. We do the same in current Aswan, but we will be able to expand that considerably with new center in Cairo. The center in Cairo will have a considerable room for treating people from the war zone area in the Middle East and from Africa, with a particular interest in the Nile Basin, African nation or sub-Saharan Africa. We also will expand our process of training and apprenticeship for doctors and nurses from the Middle East, from the sub-Saharan Africa, which is really continuation of what we're doing in a very small scale, but now we'll be able to do it in a bigger scale.
So training is one of the core objectives of the Aswan Heart Centre. It's a big pillar in our mission statement. And we've gone around training in different ways, and we offer different programs, starting with sending people abroad when it's something very focused that we want to train them on, to getting people from other countries to train, again, on areas that we specialize in. But we've obviously created a number of different training structures and schemes that fit the purpose. So we have people joining in for as short as 2-week observerships, and those are usually very young medical school students who come just to get exposed to a hospital environment, up to 2-year programs for training physicians coming in from areas outside Egypt. And we have programs again for 6 months training, and these are usually for for doctors with a degree of training in the specialty but need further refinement in a particular area of interest. So the best way is to be exactly specific what level you are at the moment, and there will always be a training program in Aswan that can fit you in.
We have a number of different visiting and training programs in the surgical department in Aswan Heart Centre. So first of all, there's an observership program where someone who's interested, whether is an established heart surgeon or a very young, inexperienced individual, would come for a short period of time to get a flavor of what happens in the center. There's also the fellowship program, which is a formal fellowship program, complete with a logbook of the cases attended or assisted in or performed, and the fellow's contribution to what goes on in the center, whether it being clinical or research. These fellowships are for 6 months, and they usually extend for another 6 months or a year. There's also the senior fellowship program, and this is a very competitive program aimed at more senior cardiac surgeons from Egypt or the region. And we've also had other cardiac surgeons come from Europe and the United States to receive, again, short periods of training for 6 months to a year.
هي مليكة قبل العملية طبعا كانت حاجة، وبعد العملية بشهر ونص بقت حاجة تانية. أحسن بكتير من الأول طبعا، يعني بقت طبيعية الحمد لله. يعني كان الموضوع فيه اهتمام عالي قوي، كان فيه سيستم وتنظيم، وده اللي يمكن يعني لو قالوا لك اقعد 5-6 أيام ما تشوفش بنتك كنت هتسكت، بسبب اللي انت عارف انت مش هتعمل حاجة، يعني انت مش هتشوفها، بس انت عارف ان كل حاجة ماشية صح، كل حاجة ماشية مظبوط.
And that's really what makes the new center unique. It's not just a hospital where we will treat 12,000 or 14,000. No, it's just we're creating a new generation. It is very important because this is about the sustainability all over the place. Sustainability. If you create good cardiac surgeon, he will be going back to his country in Africa or in the Middle East, and he practicing the same ethos, the same vision, the same inspiration of what Magdi Yacoub is all about.
Patient-centered healthcare is an essential and important concept, that everything in the hospital, I mean everything, rotates around the patients. And so the priorities in the hospital are towards the patient. But not only that, but patient satisfaction and patient involvement in the treatment is essential.
The most important part of the component in that is your human resource. Human resource is the most valuable component we have. And we have a very, very strict and rigorous process to select candidate. And because we want to hit the ground running, as they say, we started from few months ago to recruit some staff and to add to train them at Aswan, and the process of recruiting and selection will continue to run as a twin track. So we're doing the building as a construction, and we're building the human resource. We're recruiting people and we're selecting people and we're training them. Both clinicians, nurses, even the maintenance and the backroom boys, we are started the process of recruiting. Hopefully, by the time the building is finished, we would have created additional or recruited additional number of staff to be able to start working in the new center very efficiently at the same capacity. Of course, there will be a process of rotation between the new center and Aswan. So by that, we can merge the two basically to operate and function as a single unit. Either you're doing the procedure in Aswan or you're doing it in Cairo, no difference at all in terms of the ability and the qualification of the staff.
So initially, 90% was being done by missions, people from outside. Now it's all being done, 95% are being done by the local staff. However, there is very pressing need to exchange ideas, to push the level higher and higher, to have what I say, exchange of ideas and expertise, rather than come and do a few cases. That's gone. everything is being done at a high level by the local staff.
The support we've been getting from the US, the Egyptian community in the US has been extremely exciting. We're seeing a lot of goodwill, a lot of enthusiasm, which we obviously want to harness and see evolve over time. So I think the support can take various shapes and forms. There are a lot of interventional cardiologists, a lot of cardiologists, a lot of cardiac surgeons who are in the US, whom we obviously can benefit from their input. Just write to us, get in touch, and we can sort of structure how we can benefit from either your remote or physical presence on site. But similarly, we also want to make use of other non-medics. And again, it's a very rich community in the US. I've been quite fortunate to meet a number of them, and it just amazes me how diverse the Egyptian community is over there. So the support can take huge and different shapes and forms. Simple word of mouth and get the foundation introduced to your circle of friends, be it Egyptians or non-Egyptians. Obviously financial support is more than welcome always. But it's just having ambassadors for the foundation in the US who can spread the word, who can step in, and we do require help occasionally in the IT compartment. And there's a huge number of people who are IT gurus in the US.
We are very grateful to our supporters in Egypt and across the world. There's nothing better than to see people who identify with what you do. So emotional support is extremely important. It's almost as important as financial support. What we need is enough funds to keep this center going at the highest level, is to finish building our new center and keep it running as well to the best standards that we can achieve.
Because we are 100% free at the point of delivery. We do not charge a penny. Okay, so we purely depend on donation. We have a confidence that with the support of the people and for their generosity, we'll be able to meet these figures and to meet this target, and we achieve that. On the other hand, we shouldn't really look only at support as only financial support, because people can really do all kind of support. I mean, you can donate in kind. So if you basically produce some hardware or software, you can donate that to us, and that will be donation in kind. The same applies if you provide electric cables or whatever you need to build the hospital. All that really is a valuable donation, which doesn't mean that I have to give you £1 and shillings or $1 and cent. The other way is the intellectual contribution, because particularly in terms of the IT and the software and all that, any intellectual support in that line will be greatly appreciated, and we welcome all that kind of donation, because volunteers are very important in maintaining the progress of the center.
The supporters need to know that the center belongs to them, because they have contributed so much for the good of the people, and therefore the center, all of us, I consider only myself as a humble person within the institution. We need moral support. So moral support is very important. But also we need financial support. We need exchange of ideas. We need that all the supporters feel that they belong and will continue to belong to the center and be members of the family. But there are a lot of needs. في عدد كبير جدا من الأطفال مستقبلهم متوقف على إعطائهم فرصة للحياة، وده ممكن جدا إن ده يتعمل، وده هيديهم فرصة للنجاح والحياة في المستقبل. وافتكر إن دي من أجمل الحاجات اللي ممكن تقدم للمجتمع.
يجيب لي ايه في عيد الام؟ هو هديتي، صدقني القلب ده هو هديتي. الجوهره دي يعني ملهاش تمن. اسالني انا عشان انا قلبي كان موجوع. انا رحت بقول انا مش قلبي موجوع، انا قلبي بالعكس اتولد من جديد.